Hold on tight. We are about to embark on a journey that delves deep into the human body, exploring the intricate and often alarming process of how breast cancer spreads. This journey is not just about understanding a disease, it's about empowering ourselves with knowledge that could potentially save lives. So let's take a deep breath and dive in. Let's uncover how breast cancer travels inside us. Breast cancer, like many other forms of cancer, has a unique and complex way of moving through the body. It doesn't just stay confined to the breast tissue where it originates. Instead, it has the potential to spread to various parts of the body, making it a formidable opponent in the fight against cancer. Breast cancer doesn't just stay in one place. It begins in the breast tissue, but it has the ability to move beyond its point of origin. This movement is what makes breast cancer particularly dangerous and challenging to treat. The cells that make up the tumor can break away and travel to other parts of the body, setting up new sites of cancer growth. It starts in the breast tissue, but it can spread to other parts of the body. The initial tumor forms when cells in the breast begin to grow uncontrollably. These cells can invade nearby tissues and, if left unchecked, can enter the bloodstream or lymphatic system, which are the body's main transportation networks. This process is called metastasis. Metastasis is a term that describes the spread of cancer cells from the primary site, where the cancer started, to other parts of the body. This is a critical concept in understanding how cancer progresses and why it can be so difficult to treat once it has spread. First, cancer cells break away from the original tumor. These cells are often more aggressive and have the ability to invade surrounding tissues. They can detach from the primary tumor and make their way into the bloodstream or lymphatic system, which acts as a highway for these rogue cells. They slip into the bloodstream or lymphatic system. The bloodstream and lymphatic system are like highways for the cells, providing a route for them to travel to distant parts of the body. Once in these systems, the cancer cells can move quickly and efficiently, making it difficult to contain their spread. Think of these as highways for the cells. Just as cars travel on highways to reach different destinations, cancer cells use the bloodstream and lymphatic system to reach other organs and tissues. This analogy helps us understand how cancer can spread so rapidly and why it is so challenging to treat once it has metastasized. Once in the bloodstream, cancer cells travel to distant organs like the liver, lungs, bones, and even the brain. These organs provide a fertile ground for the cancer cells to grow and form new tumors. This is why metastasis is such a critical factor in the prognosis and treatment of breast cancer. In the lymphatic system, they move through lymph nodes. Lymph nodes act as filters, trapping foreign particles and cancer cells. However, some cancer cells can bypass these nodes and continue their journey to other parts of the body. These nodes act like checkpoints, but cancer cells can slip past them. Just as some cars can bypass checkpoints on a highway, cancer cells can evade the immune system's defenses and continue their spread. This ability to bypass the body's natural defenses makes metastatic cancer particularly challenging to treat. When they reach a new location, they may start forming new tumors. These secondary tumors can grow and invade surrounding tissues, just like the primary tumor. This process of forming new tumors in different parts of the body is what makes metastatic cancer so dangerous and difficult to treat. This makes the cancer more challenging to treat. Treating metastatic cancer requires a comprehensive approach that targets not just the primary tumor, but also the secondary tumors that have formed in other parts of the body. This often involves a combination of surgery, radiation, and chemotherapy, as well as newer targeted therapies and immunotherapies. Understanding how breast cancer spreads helps doctors create better treatment plans. By understanding the mechanisms of metastasis, researchers and doctors can develop more effective treatments that target the cancer cells at multiple points in their journey. This knowledge is crucial for improving the prognosis and quality of life for patients with metastatic breast cancer. Stay curious, keep learning, and let's fight this together. Remember, knowledge is power. The more we understand about breast cancer and its spread, the better equipped we are to fight it. Whether you are a patient, a caregiver, or simply someone who wants to learn more, your curiosity and willingness to learn can make a difference. Catch you in the next video. Thank you for joining us on this journey. Stay informed, stay empowered, and together, we can make strides in the fight against breast cancer. See you next time. Welcome back. In this chapter, we're shifting our focus to something equally crucial: the early symptoms of breast cancer and how to identify them. Early detection can be a lifesaver, so it's essential to know what to look for and when to seek medical advice. Let's dive in and empower ourselves with this vital information. Breast cancer can present itself in various ways, and not all symptoms are the same for everyone. However, there are some common signs that you can watch out for. One of the most recognizable symptoms is a lump or mass in the breast. This lump is often hard and irregular in shape, but it can also be soft and rounded. It's important to note that not all lumps are cancerous, but any new lump should be evaluated by a healthcare professional. Another symptom to be aware of is swelling in or around your breast, collarbone, or armpit. This swelling might not always come with a noticeable lump, but it can indicate changes in the lymph nodes, which are part of the body's immune system and can be affected by cancer. Changes in the skin texture of your breast can also be a warning sign. Look out for dimpling or puckering, which can make the skin look like an orange peel. This can happen when the cancer cells block the lymphatic vessels in the breast. Nipple changes are another symptom to watch for. This includes nipple retraction, where the nipple turns inward, or any unusual discharge that isn't breast milk, especially if it's bloody. These changes can sometimes be mistaken for less serious conditions, but it's always better to get them checked out. Pain in the breast or nipple is another potential symptom. While breast pain is usually linked to benign conditions, persistent pain that doesn't go away should be evaluated. Redness, scaliness, or thickening of the nipple or breast skin can also be indicative of breast cancer. These changes might resemble an infection or rash, but if they persist, they should be examined by a healthcare provider. In some cases, a noticeable change in the size or shape of your breast can be a symptom of breast cancer. If one breast suddenly becomes larger or changes shape without any apparent reason, it's worth getting it checked out. Remember, early detection is key. Regular self-examinations and routine screenings, like mammograms, play a critical role in catching breast cancer early when it's most treatable. If you notice any of these symptoms, don't hesitate to consult a healthcare professional. Your vigilance and proactive approach can make a significant difference. Stay informed, stay proactive, and let's continue this journey together. Knowledge and awareness are our strongest allies in the fight against breast cancer. See you in the next chapter. Welcome back. In this chapter, we're shifting our focus to an equally crucial topic: the various treatment options available for breast cancer patients. Understanding these options can provide hope and clarity during a challenging time. Let's dive in and explore the different paths to recovery and management. The treatment journey for breast cancer is unique for each individual, influenced by the type and stage of cancer, as well as personal preferences and overall health. We'll start by discussing the most common treatment modalities. Surgery is often the first line of defense against breast cancer. There are different types of surgeries, such as lumpectomy, where only the tumor and a small margin of surrounding tissue are removed, and mastectomy, which involves removing one or both breasts, either partially or completely. The choice of surgery depends on the size, location, and spread of the tumor. Radiation therapy is another common treatment. It uses high-energy rays to target and kill cancer cells. This therapy is often used after surgery to eliminate any remaining cancer cells and reduce the risk of recurrence. It can also be used to shrink tumors before surgery. Chemotherapy involves using powerful drugs to destroy cancer cells. This treatment can be administered before surgery to shrink tumors or after surgery to kill any remaining cancer cells. Chemotherapy is systemic, meaning it affects the entire body, which can lead to side effects, but it is highly effective in targeting cancer cells. Hormone therapy is used for cancers that are hormone receptor positive. This means the cancer cells grow in response to hormones like estrogen or progesterone. Hormone therapy works by blocking the body's natural hormones from reaching cancer cells or by lowering hormone levels in the body. Targeted therapy is a newer approach that involves drugs designed to specifically target cancer cells while sparing normal cells. These therapies target specific molecules involved in the growth and spread of cancer cells, offering a more focused treatment option with potentially fewer side effects. Immunotherapy is an exciting and emerging treatment that harnesses the body's immune system to fight cancer. This therapy helps the immune system recognize and attack cancer cells more effectively. Clinical trials are also an important option to consider. These research studies test new treatments or combinations of treatments to determine their safety and effectiveness. Participating in a clinical trial can provide access to cutting-edge therapies that are not yet widely available. It's important to work closely with your healthcare team to determine the best treatment plan for your specific situation. Each treatment option has its own benefits and potential side effects, and your team will help you weigh these factors to make the best decision. Remember, the journey through breast cancer treatment can be challenging, but you are not alone. Support from healthcare professionals, loved ones, and support groups can make a significant difference. Stay informed, stay hopeful, and let's continue this journey together. Knowledge and awareness are our strongest allies in the fight against breast cancer. See you in the next chapter. Welcome back. In this chapter, we'll explore an essential aspect of the breast cancer journey: post-treatment care and lifestyle changes for survivors. Completing treatment is a significant milestone, but the journey doesn't end there. Let's discuss how to embrace life after treatment and the steps you can take to maintain your health and well-being. First, it's crucial to have a follow-up care plan. Regular checkups with your healthcare team are essential to monitor your recovery and detect any signs of recurrence early. These appointments often include physical exams, mammograms, and other imaging tests. Your doctor will create a personalized schedule based on your individual needs. Managing side effects is another important aspect of post-treatment care. Some side effects like fatigue, lymphedema, and cognitive changes may persist after treatment ends. Speak with your healthcare provider about any lingering symptoms, as there are often strategies and treatments available to help manage them. Physical activity plays a vital role in recovery and overall health. Engaging in regular exercise can improve your physical strength, reduce fatigue, and boost your mood. Aim for activities you enjoy, such as walking, swimming, or yoga. Always consult with your healthcare team before starting any new exercise regimen. Nutrition is equally important. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains can support your recovery and overall well-being. Some survivors may benefit from working with a nutritionist to create a personalized eating plan that meets their specific needs. Mental health and emotional well-being are critical components of post-treatment care. It's natural to experience a range of emotions after treatment, including relief, anxiety, and even sadness. Seeking support from a counselor, therapist, or support group can provide a safe space to express your feelings and connect with others who understand your experience. Embracing a healthy lifestyle also includes avoiding habits that can negatively impact your health, such as smoking and excessive alcohol consumption. Making these changes can reduce the risk of recurrence and improve your overall quality of life. Reconnecting with your passions and setting new goals can be incredibly fulfilling. Whether it's pursuing a hobby, volunteering, or spending more time with loved ones, finding joy in everyday activities can enhance your sense of purpose and well-being. Remember, survivorship is a journey, and it's okay to seek help and take things one step at a time. Surround yourself with a supportive network of family, friends, and healthcare professionals who can guide and encourage you along the way. Thank you for joining us in this chapter. Together, we can navigate the path to recovery and embrace a healthy, fulfilling life after breast cancer. Stay strong, stay positive, and see you in the next chapter.